There's a new virus in India that is sending health officials into a frenzy in the southern states of the country. Authorities in India are scrambling to contain a rare outbreak of Nipah, a virus spread from animals to humans that causes deadly fever and has a high mortality rate. So which are the affected regions? Will the virus spread, or what's the transmission rate? And what does the population need to do to stay safe or virus-free? Dr. Vivek Nangia is Chief of Pulmonology at Max Hospital, Saket, and he's now joining us live from New Delhi to talk about this. Doctor, welcome to WION The World is One.
Thank you, Eric, for having me on your show.
Doctor, this virus doesn't have a cure or even a vaccine, but the Indian government has sought antibodies from Australia. What can the vials do at this stage? Will it stop the spread of the virus, or is it any relief to the infected persons?
Right, so that's a very valid question, Eric, that you've asked me. Monoclonal antibodies. So this is basically a newer drug which is being tried against this Nipah virus. This drug is actually just been tested for its safety, not for its efficacy yet. I think only in about 12 to 14 patients so far that it's safe. Efficacy is yet to be seen. So this has only been approved for compassionate use as, to save the patients. It does not control the spread. It is not a vaccine. It is just in kind of an antidote that they're thinking that it may work. This is M102.4 is the name of this monoclonal antibody, which is still under the phase of development and has not been tested extensively in these patients of Nipah virus.
The Indian government has sought 20 vials of this antibody. Do you think it is enough?
Well, it is certainly not enough, but then there's something you have to begin with. As of now, we only have about 5 or 6 cases. So I think to start with, we could try, but please remember, we still don't know whether they will be effective or not. But at least we are making that effort of getting the drug, which may possibly be the treatment outcome finally and may help to some extent of all our Nipah virus victims.
Doctor, there are 2 strains of the virus. Can you explain them to us?
So basically, Nipah virus is it's a zoonotic virus which spreads from the animals to the humans. It was first discovered in 1999 in Malaysia. And after that, since 2018, there have been 4 outbreaks in our country, in Kerala predominantly. This virus is, when I say zoonotic, means that it is known to exist in the animals like bats, pigs, and from them, there's a spillover into the humans, usually either with a contact with an infected animal, like if a bat or a pig is infected and you go and touch it and then it would get spread, or by their salivary secretion, their urinary secretions, or by eating a fruit that may have been contaminated or eaten by this bat previously. Fruit bats are quite common. There are nearly 18 species of fruit bats that are existing in our country. So which one, where is difficult to say, but research is still ongoing. And so that is where we are today.
Doctor, still on that, are animal to human viruses becoming more frequent? And how does the virus spill from bats into humans?
Yeah, very good question again. So this is where the problem with the pandemics and the epidemics that happen is predominantly because when there's a new virus that enters into the human race or into the human body, the human body is not adapt or does not have enough immune mechanisms to counteract that virus. See, something you've been exposed to in the past, the body will have a kind of memory T cells that can control this infection. But when you have no exposure at all, if it's a new virus altogether, then it is definitely bound to cause crisis or devastation in the human race. If you trace all the pandemics that have happened in the past, most of them have been because of zoonotic viruses, where the viruses have spilled over from the animals into the humans. Whether it was the H1N1, the swine flu, now we have this Nipah virus, even HIV was initially detected in chimpanzees. COVID occurred in probably a civet or some other mammal from where it spilled over. So it's basically because of the human and the animal contact, which has become so common now that the spillover of these viruses occurs and these diseases are happening in the humans.
Dr. Kerala, like you mentioned there, is the epicenter of the virus. At least 6 states near Kerala have issued alerts. What can those states do to avoid the spread of the virus?
So basically, what can anybody do? First of all, is that there's an individual level control, and then is a control at the state or the city level. So at an individual level control, what is important is that we do not come in contact with anybody who's suffering with this illness without wearing a proper uh, personal protective equipment. Barrier nursing, solitary and isolation of the patient is very, very important. Secondly, you should avoid coming in contact with these stray animals from where there's a possibility of this virus spreading. Third, do not eat fruits which may have been contaminated, especially this raw palm, this raw date palm sap. So this is something that you should be avoiding completely at this stage, either if it has been eaten by a bat or if it is thrown on the ground and then somebody picks up. So that would not be right to do.
Doctor,
Third is that keep washing your hands very frequently. Hand hygiene is very important.
All right.
Then at a state level, what is important is surveillance mechanisms. Research into the bats, that where is it coming from, which bat, how can they identify, how can they control the population of bat. All that needs to be seen.
All right, Doctor, sorry, I thought that you had already made your points, but it's clear that these points are very important, and thank you very much for making those points for us and for our audience, and I hope that they will take heed of those points that you've made. This is not the first time the virus has attacked the Kerala state. How has Kerala's fight against the Nipah virus evolved over the years?
So I think that they're doing a very good job. They've been able to contact, trace all the patients, all the attendants who would have visited the patients, the 5 or 6 patients that have been identified so far. All those contacts are now being kept under observation. They have been asked to go into isolation. The only problem is that the incubation period of this virus is 4 to 14 days, but could extend up till 45 days. So, that's really a long period. And if you see that even in the first 2 cases that were diagnosed in India this time, the first was a patient who came in with the virus, and then second was somebody who was visiting the hospital where this first patient was admitted. So first patient was diagnosed on 30th of August, second patient on the 11th of September, and then 2-3 other patients have been diagnosed after that. So it was found that there was a contact tracing is very, very important in these cases, so that you can control the spread of the disease. So I think they've been very effectively able to control the spread. All possible measures are being taken on literally a war footing with just 5 cases so far. It's been declared like a COVID zone kind of isolation practices are happening, and lockdowns maybe, I wouldn't know the extent of lockdown, but certainly all the control measures are in place. So I think they're doing a fantastic job in controlling it.
All right, Doctor, I know you have mentioned this, but for the benefit of our viewers, the first Nipah outbreak killed more than 100 people in Malaysia and prompted the culling of 1 million pigs to try to contain the virus. It also spread to Singapore with 11 cases and 1 death among slaughterhouse workers who had come into contact with pigs imported from Malaysia. Since then, the disease has mainly been recorded in Bangladesh and India, with both countries reporting their first outbreaks in 2001. Doctor, coming back to you, what can the Indian government do to contain human-to-human transmission, which is proving to be a tall order now?
Right. So human-to-human transmission can only be controlled by identifying all those people who've been exposed. That means contact tracing. So if there's an index case, the first case where the infection occurred, from there, whoever possibly came in contact with him at every level will have to be identified, isolated, and then monitored for the next 2 to 3 weeks. So that is the only way they can do it. There's no other way, really.
Finally, Doctor, for the benefit of our viewers and for those who are living in these affected regions, how can one tell the symptoms? What's the transmission rate of the virus and some of the preventive measures?
Right, Eric. So, what happens is that this is a virus which presents with common cold, cough, headache, fever, body aches. Patients start developing breathlessness and gradually start having the intensity of the headache increases, and then they start becoming obtunded, disoriented, dull, progressing into coma, because ultimately it's a condition where there's encephalitis is happening. And the transmission rate is very, very high. Anybody who comes in contact invariably develops the disease. A mild disease or an asymptomatic disease is very rare to happen. But even if the patient is in that phase where the incubation is still going on, is not having any symptoms but has come in contact, he could still be spreading the disease to the others. So that is what is very essential for all of us to know, that if somebody has come in contact with a patient suffering with Nipah virus, it is very important to isolate yourself to prevent the transmission to the others at home in your society. And as far as precautions are concerned, it is very important to isolate the patients, proper all standard precautions, barrier nursing, and without a PPE, you should not be visiting. Second is avoid coming in contact with these bats or pigs if pigs are the source. And third would be not to eat any fruit which could possibly be contaminated by the animals, or which has been seen lying on the ground, which may also be contaminated. This disease can spread through salivary secretions, through respiratory droplets, through contact, through blood, through urine. So we need to be extremely careful when you're coming in contact with a patient who's already suffering with Nipah virus.
Dr. Vivek Nangia, thank you very much for all your insights and for talking to us today. If you're watching this and living in the affected regions, stay safe. Doctor, thank you.
Thank you, Eric. Thank you, Eric, for having me on your show today.